And so I want to introduce our next speaker. Kristen Pendergrass serves as the Vice President of State Policy at Shatterproof. Previously, she worked at Pew Charitable Trust, leading state relations and strategy for the Substance Use Prevention and Treatment Initiative and for the Pew MacArthur Results First Initiative, helping state and local governments incorporate evidence-based policy into the budget and policy processes. Before joining Pew in November of 2015, Kristen worked as a policy advisor for the House Majority Caucus in the Oregon Legislature, Chief of Staff to the Oregon House Majority Whip, and as a legislative assistant in the Massachusetts House of Representatives. And so I'm just very pleased to introduce Kristen to kind of bring some of the national expertise that Colorado is so appreciative to have today. So without further ado, Kristen.
Thank you. All right, I got not enough hands. Thank you, Jack, and thank you all for having me. People usually think I'm lying, but I swear I don't say this at any other state. Colorado is my favorite. I have worked with Colorado since at least 2015 when I was at Pew, and I just am constantly so impressed with the work you all do in pushing the boundaries and thinking creatively and outside the box. And truly, I would say this even if the Attorney General was not in the room, truly being a leader around the country. So every year for the past 3 years, I have come to this conference and learned from all of you, and then together with my colleague Sarah Whaley, we go around the country and tell everyone what amazing work you're doing. So very excited to share with you some of the resources that are out there in the national ecosystem around this issue. Quick intro, I'm Kristen Pendergrass. I am the Vice President of State Policy at an organization called Shatterproof, and we are a national nonprofit dedicated to ending the addiction crisis. We have 3 pillars of our work. The first is educating and empowering communities. The next is ending addiction stigma. And this final one is increasing access to quality substance use disorder treatment. And then I'm on the policy team. So we get to do work that supports those 3 pillars and also cool stuff like working on opioid settlement funds around the country. So one of the main things that I do in this capacity is to convene a monthly coalition of national organizations that are working on this in this space, that are creating resources, providing technical assistance, or just have an interest in how the funds are spent. We do not have any for-profit organizations in the group, and there's only one state representative who is allowed in, and that is Jose from your Colorado consortium. He was grandfathered in from the beginning, and I thought he would be here so I could call him out, but he's not. So these are some of the organizations that are part of our coalition. Altogether, there's about 40 to 50 that are invited. It's constantly changing as we're finding out about new resources that exist and expanding the membership. So real quick, I know that a lot of people come into this space and do not have a background in substance use disorder, and I heard someone say earlier, what is MOUD? So what I'm gonna try and give are some resources that are more accessible to the public around substance use disorder, and then talk through the Opioid Settlement Fund, some of the steps and some of the resources that are specific to that. So usually when we talk about substance use disorder, there's these kind of 4 buckets, and buckets is not the nicest word, but it's the one that everyone uses. So prevention, treatment, recovery, and harm reduction. So this is by no means an exhaustive list. If you are able to get these slides later, I hyperlinked everything, so you can just hyperlink to all of these organizations and resources that are going to be coming up. But these are some of the main organizations that I think have very accessible information to the public on each of these issues. And I also want to point out down here at the bottom, I mentioned Shatterproof does a lot of work on stigma, and so that links directly to our resources around stigma. Okay, so I'm going to go through each of these and just show you what an example is so that maybe you'll feel a little more comfortable once you dive into it. So the first is prevention. This is actually a Colorado-grown initiative that I think is the best in the country. It's Blueprints for Healthy Youth Development, and it is a clearinghouse of over 130 youth development programs, and it talks about the evidence behind them all. So if someone is proposing a prevention program, you can come here and see what the evidence says about how effective it is. Next is treatment, MOUD, all these acronyms. I'm a little biased because I used to work on this project, and their main goal is getting rid of barriers to medications for opioid use disorder and barriers to treatment more broadly. But I do think that they do a really good job of explaining what a lot of the issues are and using evidence as a backbone to all of that. All of their issue briefs and blog posts and all of that are written with the public in mind. So I think it's a pretty accessible space to learn about all the issues that are going on in the treatment space. And these are just some of the newer briefs that they've put out. Next is recovery. This is one of the main ones at the national level, the Recovery Research Institute, that has kind of those issue briefs and basic 101 type things. There's a lot of local resources around recovery that I would encourage you to look into. A lot of local recovery groups and statewide recovery groups, so just keeping that in mind that this is a national resource, but check your local groups, maybe even first. And then finally, harm reduction. This is from the National Harm Reduction Coalition. A lot of great resources. You know, if you want to learn more about fentanyl, they have issue briefs on all of this. You know how you make a presentation and then you keep thinking about how it could be better? If I was redoing this, I would also include some of the local harm reduction organizations that are really wonderful. I never remember the right name for it, but the Harm Reduction Action Center in Denver. I was looking at their website. I have gotten a tour of them. If you are curious about harm reduction, I would urge you to connect with your local harm reduction organization. They usually do tours. They're happy to talk to you, and there's a lot of good resources on these websites. The other local resource that is phenomenal, and you all are so lucky to have it that I did not link on here, is the Colorado Consortium for Prescription Drug Abuse. Jose Esquivel is the person who is grandfathered into our coalition, and so I know about a lot of the work that they do, but truly an amazing resource on all of these issues, from prevention to harm reduction to workforce to all kinds of things. So I would encourage you to check that out. And then two national organizations that span all of the issues. The first is NACO. NACO has created an opioid solution center. And there's two main pieces of their website, of their opioid solution center, that I think are incredibly helpful. The first are these strategy briefs. So you guys know about Exhibit E, right? And the 9 core strategies and the other approved uses. NACO went through that whole list and picked a number of them. I think there's 25. There's a lot of them. And they look at specific topics, and it might be naloxone, or it might be addressing neonatal abstinence syndrome, or all kinds of things. And they're really accessible briefs, and they are brief, about these issues, and they talk about the evidence that's there, and they're geared towards kind of a lay county audience. So I think they're really wonderful, and hope that you will check them out. There's also a number of quick guides and stuff, which I'll talk about a little bit later, that are specific to the settlement funds piece of this. All right, let me make sure I'm not missing anything. All right, the next national resource is the website for the opioid principles. So these are the principles that were developed by Johns Hopkins University, and we have Sarah Whaley here, who led the development of the principles and has led the creation of this website and a lot of the work around that. Yeah, I could put an arrow under where the resources are, but this is the most comprehensive site for resources. There's a lot in here about evidence-based interventions. What is the one I wanted? This one is the one I wanted to point out. There's stuff from Harvard in here. I mean, it is so comprehensive. So if there's something that you're looking for that you don't know where it would be, it will be here. I know they're revamping their website and will have an update come December. But they have, like I said, very comprehensive. I'm just going to keep using that word. They have all the trackers that are on there. So a number of organizations have put together trackers where they're tracking where the money's going, or which states have this intervention, or which states have this policy. All those trackers are on there. All of these are guidance documents. And then they also have a list of relevant websites. So everything from the CDC to SAMHSA to different organizations that are involved in this space. And have really helpful information. And then one more thing I just want to point out about evidence, because I know that Colorado has been a leader on evidence-based policy, because when I worked here on evidence-based policy, I helped create this. And it's important to remember that just because something is not 100% evidence-based in terms of it being the most effective and having randomized clinical trials and all of those things does not mean it's not worth investing in, right? So if you get a pilot program on your, before your council, and they sound really promising, but you go and look in blueprints and they're not listed as an evidence-based program, that doesn't necessarily mean that you can't fund them or that you shouldn't fund them. One thing might be to make sure that you are asking for the outcomes of that investment to see if they were effective. Does that make sense? So you get a pilot program. You don't just want to throw money at new programs with no evidence, but you do want to try new things. This $56 billion that states and local communities are getting is an incredible opportunity to try new things, to be innovative. And so if you are considering investing in one of these programs that have a great idea, but not a whole lot of clinical evidence behind it, make sure that you're pairing it with an evaluation, or at least looking at the outcomes that they're achieving. One state I will call out that's not Colorado, rare that I do this, Oregon actually in their statewide opioid settlement council is prioritizing programs that can help build the evidence base. So if there is an innovative program and they have an evaluation component, they're actually prioritizing those programs to help build the evaluation base, for the state, but also for the whole country. All right, I'm gonna keep moving, and then if we have time, because I talk really fast, hopefully we'll have a little bit of time at the end for questions, but TBD. Okay, so steps in the process. I hope you all have seen these, the principles for the use of funds from the opioid litigation. I should know them by heart, but I still need my cheat sheet. First, spend money to save lives. A lot of this is the structural stuff about creating a separate fund and making sure that money is going towards opioid interventions and trying to reduce the harm. The next is using evidence to guide spending. We talked about evidence and places where you can find evidence-based interventions. Youth prevention, I'll point you back to blueprints again. Racial equity, the point that I have forgotten to make thus far is that there is a kind of partner set of principles specifically for tribal populations. So I'm happy to add that hyperlink in, but it is also developed at Johns Hopkins, and it is a separate but aligned set of principles for the use of funds from the tribal litigation. And then finally, develop a fair and transparent process, which is what I'm gonna dive into more. So what we've done with that develop a fair and transparent process is broken it down a little bit more into some easy steps. And I imagine you all are very familiar with these, you've done these. Start at the top, do a needs assessment so you understand what is actually in the community and where there are gaps. Getting diverse input on your council from diverse places. I have heard over and over again that Colorado is doing the best job at incorporating the voices of people with lived experience and in a way that is meaningful. So kudos to that, and I do talk about that in other places. This one on the bottom right, strategic prioritization, sounds fancy, but it's really the hardest one, I think, in a lot of ways, in that there's so much money in this space, and trying to make sure that we're not duplicating efforts, figuring out how to braid and blend funding. I'll talk about some of the resources that exist for that, but frankly, no one's figured it out perfectly. Transparent reporting, I'm just gonna call out Jamie, even though she's not here. Colorado, the Attorney General's office is leading that, and I think you guys are doing, between Colorado and North Carolina, the best jobs in the country about reporting and transparency. And then tracking outcomes, which in other states I say is kind of a 2.0, don't worry about it yet, but I know that Colorado is already thinking about this. How do we make sure that our investments are having an impact, that they're moving the dial, not only just in overdose deaths, hopefully bringing that number down, obviously, but what other outcomes should we be looking at? Is it the number of people who are receiving a certain kind of medication, or is it the number of overdoses that have been reversed? Thinking about different outcomes that we can be tracking. Okay, so we're gonna dive into each of these a little bit more deeply. Needs assessment, I mentioned that NACO, their Opioid Solution Center, has those strategy briefs, which are on each of the strategies, like naloxone, MOUD. They also have these quick guides, which they developed in partnership with Johns Hopkins, and this is their one about a needs assessment. So they're each 2 or 3 pages long, very digestible, and just talking about some of the best practices to think about. This one in particular I think is great because it shows that you don't need to spend millions of dollars on a consultant or a contractor to do a needs assessment. There are ways to do it within the existing resources of a local community, using the Department of Public Health, which someone mentioned a minute ago, and other sources that are already there. Next is council membership. So we talked about having a diverse representation, people with lived experience, but also professional diversity, racial diversity, ethnic diversity, making sure that the council membership is available to everyone and that everyone is able to weigh in, even if they're not on the council. There's been some work done recently by KFF Health News about whether or not councils allow for public comment. And then the other resource, so there is a quick guide about creating a diverse council and things to think about in the council membership. The other thing I want to point out is the Georgetown brief on conflicts of interest, which I think is really interesting. Again, I imagine Colorado is already doing all of these things, but it brings up some interesting points about where are conflicts of interest and are there things that councils should be doing to ensure that there aren't conflicts of interest. In other states, we see where a treatment center will apply for funds, but the person who runs the treatment center is on the council, and so then they're voting on whether or not to approve the funds, and it gets a little sketchy. So that brief is really interesting. It's also short, but talks about some of the ethical considerations in creating and maintaining a council. Okay, this is the big hairy one about funding streams and braiding and blending funding. These reports from the Bipartisan Policy Center are excellent. They're about 80 pages, and I've never read them all in depth, but if you're curious about the federal funding and all the different funding streams, there is a lot of good information in these reports. It's a lot to disentangle and figure out between Medicaid and SAMHSA and all the federal money coming down and all the state money coming down and then all the grant funding. But those two reports are really excellent if you want to dive into this stuff. And then the other thing I'll point you to is these financing principles from Pew. They only touch on opioid settlement funds as one of the available funding streams for funding SUD treatment and services. But this, I believe, links straight to a PowerPoint that I found that they did on this, which I think is pretty clear, so it can give you an idea of all the different funding sources that are out there. You guys may have heard about not supplanting funds and making sure that anything you invest is supplementary. This is another way to understand all the different funding streams and making sure that a council isn't funding something that Medicaid would pay for example. If you guys have questions on any of this and you want to dig deeper, I'm going to put my contact information up at the end. Please feel free to reach out, and I'm happy to connect you with the people who are leading these efforts. All right, reporting, as I said, I'll just refer you to Jamie and the Attorney General's office. They have done a wonderful job. Sarah and I have worked very closely with them in creating their reporting processes and thinking through what they should be reporting and how. Sarah and I have also worked on a national effort to figure out where the funds are going nationwide in every state and county where the funding decisions have been made public. And Colorado's was one of the easier states to do because you guys have such good transparency in reporting. And then finally, the kind of 2.0 of tracking outcomes. This is a resource that was created by Johns Hopkins. It's called Osprey. There's a link to it over there, and there's also a quick guide underneath. This is really helpful. I know that you guys also in Colorado have a data working group that is trying to think through what kind of data points do we need to be following, what do we need to be reporting, what do we need our grantees to report back to us. These are all really important discussions, and I'm really excited to see over the next couple years what kinds of things states that are able to do that are able to show in terms of improved outcomes. But I will let you peruse that at your leisure and not belabor it now. All right, and then finally, a couple of new resources that are out there that we just recently learned about that I think are really interesting. and I think potentially very helpful. The first is from the SAFE project, and it's called Safe Solutions. Let me see if it'll come. Here it is. So the way that this works is you can search by outcome, which are these circles, or by continuum of care down here. So if you want to learn more about, what did I do in my, I think I did housing over here, safe, stable, and affordable housing. You can click on it, and it brings down this drop down. So within affordable housing, here's all these different aspects of it. You can see the buckets. And then any of these that you click on, it goes to a wiki page, which looks like Wikipedia, but they have put all the information there. And it has, hang on, I wrote it all down because there's a lot of it. It has key information, the evidence, policies. So if there's a federal policy, a state policy, a local policy, tools and resources, examples, and promising practices. So within each of these, there's all that information there. So if you are looking for a way to address housing, here's a menu of ideas that you can learn more about. Again, I think it's pretty accessible to a lay audience, and within the wiki pages, there's links to outside resources. You could really go down some rabbit holes. But it's very comprehensive, and there's a lot of good information here. And then the other thing that you can look at, I picked down at the bottom, there were those other options along the continuum of care. I picked recovery, and same thing. There's this list of things if you want to learn more about, how can we strengthen peer recovery support services? Then you can click on that, and it'll go to the wiki page with all this information about the evidence that's out there and different pilot programs that are out there. So again, a really great resource that I just learned about like a month ago. So happy to share that with everyone. And then the final one is from the National League of Cities. It's this really interesting dashboard that I'm not on a council, so I'm not quite sure how useful it is, but you put in which state you're from, the city, and the county, and you get an idea of how much money you're looking at. And then there's this kind of menu of interventions that you could think about within those monetary amounts. So again, just a newer resource that's out there. May or may not be super helpful, but wanted to show everyone that it exists. And then finally, oh, whoa. I think I went to the end. That was weird. I know what the last slide said. It's 2 organizations to follow and then a news organization, which I know are constantly updating and having new resources. The first is NACO, their strategy briefs. They have a leadership group, so they got a number of counties from around the country to kind of participate in this learning collaborative to talk through all of the issues that they're seeing around opioid settlement funds and share their findings and share kind of their lessons learned. So NACO has a ton of good resources that they're continuing to update constantly. And then Hopkins' website truly is like a wealth of information. As I mentioned, they're going to be updating their website come December. You heard Attorney General Weiser talk about the awards. We are giving out those awards on almost a quarterly basis, highlighting a couple of states, but mostly now we've turned to local communities to kind of highlight some of the innovative things that are happening at the local level. I imagine you guys know this, but Colorado is one of only 3 states that I can think of that is taking a regional approach. But I think that there's a lot to learn from the county and maybe even the city experience. And then finally, KFF Health News. We work really closely with Aneri Patani, who leads a lot of the work that KFF is doing, and they're trying to highlight some of the challenges. It's not really gotcha, but it's what is happening out there, what is good, what is maybe not so good, how do people feel about it. This is an example of one of their more recent stories. And as I mentioned, Sarah and I, Hopkins and Shatterproof and KFF Health News, have been working for more than a year now on tracking settlement fund appropriations across the country. And we're expecting that all of that data and reporting will be available probably in mid-December. So KFF Health News is continuing to put out new research and new information. And I think that's the last slide I have. And I don't really want to touch the clicker. Yeah. Feel free to reach out to me. I know people say that. I genuinely mean it. If there's anything that you want that you can't find, tell me, because we have a meeting in a week that I just told Sarah, I think I might cancel it because we don't have anything to talk about. So if you have a resource that like, it'd be really great if someone would do this, let me know and I can bring it to this group of 30 organizations and see if anyone is working on it, has already done it and just not told everyone, or if anyone has the bandwidth to do it. That's why we're here. That's why we created this coalition, was to create resources that are actually helpful to people. So if there's something that you want or that you think you might need in the future, please let me know, and we'll do our best to get it to you. And you can also always go through the Attorney General's office here, talk to Jamie or Jack or Christian, and they can reach out to me and or Sarah. So that's all I have. I am happy to answer any questions if people have them. Sorry, I know I snuck that on you.
Thank you for that. That was really a wealth of information and really helpful. How would you go about getting on the coalition?
Yeah, so we are constantly adding new members. The National League of Cities with that dashboard, they just joined us a couple weeks ago. We're very informal. We only take, though, national organizations and nonprofits. So like I said, Jose is the only state representative who has been grandfathered in. We just don't want it to get so big that it's unwieldy, but if you are a nonprofit and you want to come and learn and share and everything, just email me and we'll figure it out. Yeah. Does anyone else have questions? Yeah. Oh, thank you.
So first of all, thanks so much. This is fantastic. We're working with localities that are moving past the strategic planning phase and are ready to start putting out RFAs, RFPs. And one of the questions that we constantly get is, how much money should I be devoting to this? Like, how much does this cost? And we've been able to cobble together some estimates, but they're obviously very broad, and it depends a lot on like local context. Are there any resources? Is there anybody out there that is creating a toolkit to speak specifically about what Exhibit E strategy 1.2 would look like, and then the different sorts of components that would go into it? Do you know of anything that gets that granular in terms of financial considerations for those different strategies?
No. I asked Safe Solutions if they were going to add funding information into that wiki, and they said that they hadn't thought about it. Sarah, do you know of anything?
I don't, but that's a really cool idea, and it might be a little tricky because it will depend on like what's already there, how much money the jurisdiction has, but it's something I think we could look into because that's a really good question.
And I will say, Jose, welcome you, but we're really looking to Colorado to see what does kind of 2.0 of this effort look like. Everyone's kind of, everyone's way behind you guys, but getting it figured out, and you guys have it figured out, and so now you're going on to the next piece of it. So like Jamie and I have been talking about, when you have new commissioners and new council people come in, how do you get them up to speed? And anyway, so I'm really excited to hear the questions that are coming up about like, okay, how do we go to 2.0, and thinking about how we can meet that need.
Yeah, and I think there's one question. Hi, folks. Jose Escobar with the Colorado Consortium. And particularly, I think, to help out the local regional folks, this question came up around some of the support for MAT in jails. And the jails trying to figure out, well, really, what is the cost? Because I know that a few regional folks got a proposal from the jails, and they're going, oh my gosh, it costs. We can't really support all of that. And so it did bring up a question for us to figure out, well, can we at least give people a range of what is, so you're not totally shocked by it? And no, you might not be able to fund all of it, but you could at least say, we could maybe fund portions of this, but we can't all. So you did bring up a good question. Nationally, I've not seen anything done nationally. I know statewide, we're working with the Colorado Sheriff Association and the Colorado Jail Administration to figure out some of those costs, so that we can maybe offer some guidance to you all that want to support that. But I could see this question also being relevant to peer support. We've had some great sessions here today on peers, but what would that mean? What's a livable wage? How do you support these folks? We are working to professionalize that field more and more so that they could get maybe reimbursed by insurance or Medicaid, but we're not there yet. In the meantime, settlement funds could help, subsidize some of those salaries, but we need to give you guys a sense of what would a reasonable cost be to hire someone at this different level. So I appreciate your question. We're thinking about that at the state level, but I've not yet heard about this at the national level to give guidance around, what's the sticker price? Is there sticker shock to this, or how do I know that this is reasonable for me to fund something?
There's that one Harvard report that does dig a little bit into the financing of stuff. It's the orange one. I don't know if that's helpful. The orange one.
I have to go back really
It's
far.
on our website.
Yeah.
It's like one of the first two under guidance reports.
Yeah.
So, yeah.
Is that the Arnold Ventures one?
Yes.
All right, last question.
Not so much a question, but I was just going to say that I don't know if it might be too granular, but within the region itself, if there are areas that have done feasibility studies and those are based, I'm happy to share ours, and I don't know if there are other regions that are making them public, but if it happened to be similar projects or something, that might be at least a point of reference because it's in the state and it's within our framework.
But that's a very good point that you all at the regional level, you could maybe be asking some of the service providers to give you some of that information to say, give us a sense of that range of cost based on X, Y, and Z, just for reference. While you're waiting to do the next round of funding, this could be a good time to reach out to different service providers just to get a sense of what are your costs generally, annually, or whatnot. But you could probably start doing some of that locally.
All right. Well, thank you, everyone. Seriously, if you have questions, ideas, suggestions, please reach out. Don't hesitate. And I thought Jack would be back, but it looks like we have a 30-minute break. So we'll meet back here to hear from Sarah, do some interactive stuff around transparency and digging deeper into that.
Kristen also mentioned the awards, and just because the state of Colorado won an award does not mean that the regions or local jurisdictions can't apply. So if you are really proud of what you're doing, please apply for an award. We would love to spotlight not just the state, but all of the great work that's happening here.